Welcome to the Dr. Izzy's Medical Podcast channel.
Question: what is the cell type of origin for a neoplasm that tests positive for chromogranin, bomazin or synaptophysin? Answer: neuroendocrine. Question: which antibody is involved in type 2 membranoproliferative glomerulonephritis? Answer: C3 nephritic factor. Question: what is the gold standard procedure for screening for cervical carcinoma? Answer: Pap smear. Question: where is the location of the myocardial infarct if there are pathological Q waves in ECG leads I and AVL, left leads? Answer: lateral wall. Question: which COPD is associated with pulsus paradoxus? Answer: asthma. Question: how do intracellular calcium levels change in cellular injury? Answer: increase. Question: what is entropion? Answer: inward rolling of the lower eyelid. Question: which type of macrocytic anemia arises due to impaired DNA synthesis? Answer: megaloblastic anemia. Question: which congenital infection is associated with patent ductus arteriosus? Answer: congenital rubella. Question: what type of restrictive lung disease is associated with acute respiratory distress syndrome? Answer: interstitial. Question: which mechanism of cell death is associated with shrunken cells with more eosinophilic cytoplasm? Answer: apoptosis. Question: what does the S in CREST syndrome stand for? Answer: it stands for sclerodactyly. All means of CREST are calcinosis and anti-centromere antibodies. Raynaud phenomenon. Esophageal dysmotility. Sclerodactyly. Telangiectasia of the skin. Question: what is the cell type of origin of a neoplasm with visible neurosecretory granules? Answer: neuroendocrine. Question: what is empyema? Answer: pus filling the pleural space. Question: what is the classic triad of symptoms seen in Vernica's encephalopathy? Answer: confusion, ataxia, and ophthalmoplegia. Question: how does urine concentration normally change following the water deprivation test? Answer: increase. Question: what gene is mutated in a beta-lipoproteinemia? Answer: microsomol triglyceride transfer protein. Question: which Wilms tumor syndrome is associated with mutations of WT1? Answer: Dennestrash syndrome. Question: how does the risk of achondroplasia manifesting in a child change with advanced paternal age? Answer: increased. Question: what pathology is associated with hypersegmented neutrophils? Answer: megaloblastic anemia. Question: what three endocrine glands are commonly implicated in multiple endocrine neoplasia 1? Answer: parathyroid hyperplasia, pancreatic endocrine tumor, pituitary adenoma. Question: what is the mechanism of tissue damage in Wilson's disease? Answer: Popper-mediated hydroxyl-free radical tissue damage. Question: what color does amyloid show in polarized light following staining with Congo red? Answer: apple green birefringence. Question: which heart valve is most frequently involved in endocarditis? Answer: mitral valve. Question: which arterial oxygen saturation is diagnostic of hypoxemia? Answer: arterial oxygen saturation less than 90%. Question: which neoplasm is associated with post-surgical gastric remnants? Answer: gastric adenocarcinoma. Question: what misfolded protein is the major component of Lewy bodies seen in Parkinson's disease and Lewy body dementia? Answer: alpha-synuclein. Question: what type of hallucinations are the most common in schizophrenia and related psychotic disorders? Answer: auditory. Question: how do lung volumes change in COPD? Answer: increase. Question: which neoplasm is associated with Barrett esophagus? Answer: esophageal adenocarcinoma. Question: which type of diabetes mellitus is associated with diabetic ketoacidosis? Answer: type 1 diabetes mellitus. Question: which sex chromosomal disorder is associated with horseshoe kidney? Answer: Turner syndrome. Question: where does breast cancer metastasize to? Answer: lung or bone. Question: what is the cause of chronic urate nephropathy? Answer: chronic hyperuricemia, gout disease. Question: what gestational age is associated with post-term babies? Answer: greater than 42 weeks. Question: which enzyme involved in de novo pyrimidine synthesis is defective in erotic aciduria? Answer: UMP synthase. Question: which gender is more commonly affected by rheumatoid arthritis? Answer: females. Question: which enzymes converts arachidonic acid into leukotrienes? Answer, 5-lipoxygenase. Question, what is the most common cause of primary hyperparathyroidism? Answer, parathyroid adenoma. Question, what is the most common cause of acute pancreatitis? Answer, alcohol, gallstones. Question, what are Heinz bodies a common sign of? Answer, G6PD deficiency. Question, what is the non-pharmacological treatment of depression? Answer, cognitive behavioral therapy. Question, what is the typical presentation of prolactinoma in females? Answer, galactorrhea and amenorrhea. Question, what type of bilirubin will be elevated in jaundice due to a biliary tract obstruction? Answer, CB. Question, which large vessel vasculitis is associated with polymyalgia rheumatica? Answer, temporal giant cell arteritis. Question, which pattern of necrosis is characteristic of an abscess? Answer, liquefactive, proteolytic enzymes from neutrophils liquefy tissue. Question, which complement protein is chemotactic for neutrophils? Answer, C5a. Question, which cancer is associated with nickel? Answer, lung carcinoma. Question, which type of renal cyst accounts for the majority of all renal masses? Answer, simple. Question, what is the most likely cause of endometriosis? Answer, retrograde menstruation. Question, which amino acid is used as a precursor to melanin? Answer, tyrosine. Question, which enzyme is defective in G6PD deficiency? Answer, glucose 6-phosphate dehydrogenase. Question, what type of heart failure is associated with jugular venous distension? Answer, right heart failure. Question, what is the etiology of scleroderma? Answer, fibroblast activation leading to collagen deposition. Question, what are the 4 carcinomas that spread hematogenously? Answer, renal cell carcinoma, hepatocellular carcinoma, follicular carcinoma of the thyroid, choriocarcinoma. Question, which type of generalized seizure presents with a blank stare, 3 Hz brain waves and no postictal confusion? Answer, absence seizure. Question, what change in skin color is seen in hemochromatosis? Answer, bronze coloration. Question, which cancer is associated with Leigh-Strauss sign? Answer, gastrointestinal carcinoma, gastric carcinoma. Question, which stage of platelet plug formation is defective in von Willebrand disease? Answer, platelet to von Willebrand factor adhesion. Question, what is the most common cause of infectious arthritis? Answer, Neisseria gonorrhea. Question, how does the ST segment shift in stable angina? Answer, ST segment depression. Question, what surface proteins on leukocytes binds to ICAM, VCAM on endothelium? Answer, integrins, LFA1. Question, which chromosomal translocation involving BCL2 causes follicular lymphoma? Answer, T14, 18, to the Ig heavy chain gene. Question, which sex exhibits a higher risk of suicide attempts in depression? Answer, women. Question, how will cortisol levels change following a dexamethasone suppression test in a patient with ectopic ACTH secretion? Answer, no change, remains high. Question, which form of urothelial carcinoma develops as a low-grade tumor and then progresses to an invasive high-grade tumor? Answer, papillary. Question, which age group is most commonly affected by mantle cell lymphoma? Answer, older males. Question, how many cellular division occurs in a neoplastic cell population before the earliest clinical symptoms arise? Answer, 30. Question, which type of central nervous system hemorrhage yields the worst headache of life? Answer, subarachnoid hemorrhage. Question, what is the mechanism through which aflatoxins from Aspergillus induces hepatocellular carcinoma? Answer, induction of p53 mutations. Question, which renal disorder is associated with a renal tubular cast containing tubular epithelium? Answer, acute tubular necrosis. Question, which anemia is associated with macroovulocytes? Answer, megaloblastic anemia. Also occurs in bone marrow failure. Question, which stage of Paget disease of bone involves increases in both osteoclastic and osteoblastic activity? Answer, mixed. Question, what blood pressure is diagnostic of hypertension? Answer, greater than or equal to 140/90 mm of mercury. Question, at which area of the lung is Pannisonar emphysema most severe? Answer, lower lobes.
Thank you for listening Dr. Izzy's medical podcast series. If you want to support this project, please subscribe the channel and like this video. Thank you.